PNC News First is presented by the Bank of Guam, the People's Bank. Pizza Hut, we're taking pizza to where it's never been before. Taco Bell, the only place where you live Moss. IT&D, explore your world. Guam Cleaning Masters, keeping Guam clean. Shibby Wholesale, home of Vinda and Unilever products. Häagen-Dazs, distributed exclusively by quality distributors.
PNC News First, broadcasting live in high definition from Tumon, Guam, on KEQI and KTGM, and on KPPI on Saipan. Here is your PNC News team.
Half a day, you're watching PNC's News First. We're live from our broadcast center in Akanta, Kwahusi Polisu, but thanks for tuning in. Topping our newscast tonight, the Guam legislature held a hearing today on its proposed spending priorities for American Rescue Plan Act funds. PNC's Wayne Chargloff has more.
The Guam legislature held a hearing today on Resolution 93. The resolution was to formally submit the legislature's preliminary list of spending priorities for American Rescue Plan Act funds. It was introduced by Speaker Teresa Lahi and Senators Joe Augustin and Christopher Duenas. The governor has sole authority on how to spend the funds. Last month, the governor told Newstalk K57's Patty Arroyo that she has continuously reached out to the legislature to discuss the best way to spend the ARPA funds. That included a meeting at Adelup that proved controversial when Senator Joanne Brown accused the governor of violating open government laws by holding the meeting behind closed doors.
This is not money for the legislature to appropriate. Right. This is at the total discretion of the governor. However, I, will work very closely with the legislature, as I have done, as you have seen, and it created a controversy about open government, secret, and all that. But the main purpose for that is to listen to their priorities and to get their priorities. And I am very glad that their priorities align with our administration's priorities.
Speaker Terlahi, however, stated that the legislature's spending priorities are simply being compiled for the governor's consideration. The speaker opened the hearing by presenting the legislature's 5 spending priorities. $68 million for direct assistance to individuals and families, more than $233 million to expand health care services, more than $341 million for infrastructure and technology upgrades, $18.5 million to develop the workforce, and more than $3.2 million to streamline and upgrade government services. A broad swath of the community came out to discuss the spending plan. A number of organizations and agencies made their case to have some of the money go to them. Private citizens, ranging from business people to former senators, testified as well. Much debate centered on whether to treat the money as a windfall to be spent on needed resources right now or as money to be invested with a more long-term approach. Towards the end of the hearing, Speaker Terlahi thanked those who testified during the hearing and mentioned that the governor has not sent her own spending plan to the legislature. She finally concluded the hearing with a call to the public to continue making their voices heard.
We have worked hard to unite and put forth a preliminary plan for the ARP funds, and we hope that this is the beginning of a dialogue and good faith efforts to incorporate our ideas and the ideas of the community and government agencies into the governor's final plan. I urge the community to continue to be vocal in influencing how these funds are spent and to be persistent in holding this government accountable for these funds.
Wayne Chargaloff, PNC News First.
The legislature will continue accepting written testimony on Resolution 93 until June 18th. In partnership with the Guam Visitors Bureau, the Office of the Governor announced the launch of VaccinWin, which is an incentive program for fully vaccinated individuals. PNC's Destiny Cruz has more.
Earlier today, Governor Lou Leon Guerrero and Lieutenant Governor Josh Tenorio were joined by former Governor GVB President Gutierrez and the Chief Medical Officer of the Department of Public Health and Social Services, Dr. Felix Cabrera, to announce COVID-19 vaccine incentives. In the effort to achieve Operation Liberate Guam's mission, which aims to reach herd immunity by Liberation Day, Governor Lou Leon Guerrero stated that she is targeting to get 80% of Guam's adult population vaccinated, or 96,000 people, adding that 13,000 more people would need to receive the vaccination to reach Operation Liberate Guam's goal.
As of today, we have vaccinated 82,778 people. To achieve herd immunity, we are targeting to vaccinate as many as 80% of our adult population. or 96,000 people.
Shortly after the governor's opening remarks, she announced the launch of the incentive program Vax and Win, which is being made possible in partnership with the Guam Visitors Bureau. Starting on June 16th, fully vaccinated Guam residents aged 18 and older can enter weekly to win a brand new car or a cash prize of $10,000, and fully vaccinated residents 17 years old and younger are eligible to win a $500 gift certificate to the Micronesian Mall, along with other prizes which are available to win until Liberation Day.
Starting June 16 and every Wednesday, leading up to Guam's liberation on July 21st, residents 18 years of age or older who received their COVID-19 vaccine on Guam are eligible to win either $10,000 in cash or a brand new car. And for our vaccinated residents who are 17 years of age and younger, you will also be eligible to win great prizes, such as a $500 gift certificate from Micronesia Mall.
According to the governor, the prizes will be paid for by several federal grants for outreach and incentive programs. Individuals who have yet to receive a complete vaccination are encouraged to do so, as they can enter Vax and Win after receiving both doses of the vaccine. For more details and for a chance to win, log on to visitguam.com/vax and fill out the entry form. Destiny Cruz, PNC News First.
AmeriCorps volunteers are helping people at GMH file for assistance programs. PNC's Don Sulat has more.
GMH's 2020 payer mix has shown that patients are paying through private insurance, which take up 29%, Medicaid 21%, Medicare 29%, MIP 7%, and lastly, those who are self-pay make up a total of 14% of the mix. In a K57 interview with My Habib, AmeriCorps Program Director Melissa Quinata says their members help with financial literacy and patients who pay out of pocket.
A bunch of our members there, they provide financial literacy information, and they basically provide a lot of that information to our inpatients. And so inpatients who are deemed self-pay, we work with registration and with the social workers, and what we do is we try to go in and see if they need assistance. They've already been given an application, and we try to go over maybe some unfamiliar terminology that they're not aware of or maybe haven't been exposed to, and our members go in and talk about it and break it down into layman's terms and assist them with whatever other additional documents they may need by giving that extra information.
For individuals or patients who have been previously denied any medical assistance programs, AmeriCorps is reminding them that they can always apply again.
And one of our biggest things is that even those who eventually do the whole process with us, they fill out the application, they take the initiative, and they go out and they get all their supporting documents to submit with their application, and then they get denied or they're disqualified for either income or residency. Those are also the people that we're also trying to reach out to, making sure that they understand you can always apply again.
Don Sulat, PNC News First.
Fully vaccinated travelers going to the CNMI no longer have to quarantine upon arrival. Effective yesterday, verified vaccinated travelers can go straight to their home or lodging if they complete the mandatory health declaration form at least 72 hours prior to their arrival. For travelers who were vaccinated outside of the CNMI, they must provide an official immunization record from their vaccine provider. The U.S. Centers for Disease Control vaccination record cards are not accepted for travel into the CNMI. Travelers coming from level 1 jurisdictions do not have to test upon arrival. However, they will have to undergo a lodging or home assessment and will be tested on the 5th day after arriving. Those who are coming from a level 2 or higher jurisdiction can now be tested at the airport if they submitted their required entry documents at least 72 hours prior. Masks in public areas are still necessary. The Committee on Health has announced a series of hearings and is inviting public input on Bill 11236. The measure is intended for those harmed by medical negligence who cannot afford mandatory arbitration while ensuring confidential screening and protection of doctors against frivolous claims. The bill would enact a case screening system in place of costly mandatory arbitration. Costs of arbitration on top of the cost of potential trial have deterred the filing of claims by those who cannot afford the upfront costs. The information hearing on Wednesday, June 23rd at 5 to 8:30 p.m. will feature an introduction of the bill and a comparison with current mandatory arbitration law provided by the bill's sponsors, members of the Guam Bar Association, and malpractice insurance representatives. Meanwhile, for the public hearings on Wednesday, July 7th and Monday, July 12th at 5 p.m. to 8:30 p.m., medical professionals and the public are invited to submit testimony on the bill at the Guam Congress Building or via Zoom. Those interested in presenting written or verbal testimony should contact the office of the Speaker, Therese Chalai, at 472-3586 or Senator Chalai Guam at gmail.com by July 6th. Don't go away. After the break, we'll look at a mural celebrating Mental Health Month, Teason High School's graduation, more Pride Month celebrations, and more.